Welcome to your Local Insights report. This walkthrough will explain what each section of the report means and how you can use the insights to drive performance improvements. The first page is the branch dashboard, which gives you a glimpse of key indicators and an overview of your performance. Let's start with prescription items and nominations. This top section shows your latest month's item count, total value, and year-over-year growth, giving you an instant read on volume. Below this, you'll see trends over 6 and 12 months. You'll also see how your item performance compares locally and versus the national industry average. Useful for seeing if a rise or fall is unique to you or part of a wider pattern. Under that, you'll find nominations. This tracks how many patients have nominated your pharmacy as their preferred dispenser. It shows both your current week and your growth rate over the last 3 months. Next, we have data on surgeries, the GP practices that are sending prescriptions your way. This identifies your top contributing practice and growth percentages among your next top 4 practices. These growth figures show whether relationships are strengthening or weakening. The lower section of this page gives a snapshot of services, from NMS and blood pressure checks to pharmacy first and contraception consultations. Here, your service activity is also benchmarked against the local average and the wider industry. Use this to identify underutilized services. If neighboring pharmacies are claiming more, it may suggest missed opportunities in your area. Pay attention to the missed opportunity cost figures. These estimate the value of services you could have claimed if you met your targets and thresholds for your services. Even small increases in service claims can make a significant impact on your revenue. This summary dashboard is your high-level overview, ideal for identifying what's working, what's not, and which areas deserve a deeper dive in the following pages. The pharmacy performance page helps you understand how your pharmacy is performing compared to others in your local area. Firstly, a map displays your pharmacy's location relative to the other 10 closest pharmacies in your area. This allows you to quickly visualize the relative distance between you and local competitors. Each pharmacy is listed and ranked by the total number of prescription items dispensed over the past rolling year. Looking at the table, you can compare your own item volume and growth across different timeframes, including the latest month, the last 3 months, 6 months, and 12 months, against your neighbors. Your pharmacy is highlighted for easy reference, and each figure is paired with a percentage change to help you quickly spot whether you're growing faster or slower than those around you. Below the table, there's a trendline visual showing how your item numbers are progressing over time, compared to your local average, ICB average, and the national industry trend. This gives you context on whether your changes are specific to your pharmacy or part of a wider pattern. Below that, you'll see your nominations trend, which tracks how many patients have chosen your pharmacy as their nominated dispenser. You can see how you're performing in terms of nomination volume and growth compared to local competitors. Use this page to assess how competitive your position is in the local market and whether you're gaining or losing ground over time. The practice performance page focuses on where your prescriptions are coming from, specifically which GP practices are generating the most item volume for your pharmacy. The top of this page has a map showing the proximity of these practices to your pharmacy. The map is limited to 10 closest practices, as these are the most likely to influence your dispensing numbers. Each practice is listed along with the number of items they've prescribed to you over the rolling year, the percentage that represents of your total item count, and what share of that practice's total prescriptions you're receiving. You'll also see growth rates for the past 3 and 6 months, both for your pharmacy's item volume from that practice and for the practice's overall prescribing trends. This helps you understand whether your relationship with a particular practice is improving or weakening, and whether that practice itself is growing or declining. The table helps you identify your top 10 contributor practices. You might notice that, for example, that you're getting a low share from a nearby practice, which could highlight an opportunity for engagement. This page is especially useful for relationship management, helping you track referral patterns and explore whether increased communication or collaboration with a particular GP practice could improve your performance. The Practice by Pharmacy page shows you where your top GP practices are sending their prescriptions, not just to your pharmacy, but to all others in the local area, including online pharmacies. For each practice, you'll see a breakdown of the pharmacies dispensing their items, along with the year-over-year growth in item volume each pharmacy has received from that practice. This lets you see whether other pharmacies are increasing their share of prescriptions from your key practices, and if so, by how much. If you notice competitors gaining ground from one of your core practices, that could signal a need to re-engage or strengthen that relationship. You'll also spot where online pharmacies are picking up business from your local surgeries. This is important, as online providers can be a growing source of competition, especially if patients are moving away from physical branches. Overall, this page helps you understand the competitive landscape around each practice. Use it to spot potential threats, monitor shifts in referral behavior, and develop targeted actions to protect or grow your share of prescription items from key surgeries. The Services section helps you assess how your pharmacy services activity compares to that of your local competitors. It focuses on services like NMS, DMS, hypertension, and contraception. Each row represents a pharmacy in your local area, including your own, and shows how many service claims were made in each category over the past year. This gives you a clear picture of who is delivering services at scale and where you might be falling behind. You'll also see associated figures like missed opportunity cost, which estimates the financial value of services you could have claimed if your activity met targets or thresholds. This helps translate service underperformance into real monetary impact. Looking across the table, you might notice that some pharmacies are consistently claiming higher volumes across several services. That can indicate either more efficient workflows, stronger engagement with patients, or simply more proactive service delivery. Use this page to benchmark your activity and highlight potential areas to focus on, especially where neighbouring pharmacies are delivering more. If they're managing to complete more consultations, the patient demand likely exists for you as well. This page continues with a service comparison from the previous one, but focuses specifically on Pharmacy First. For each pharmacy listed, you'll see how many clinical pathway claims they've made in each category over the past year. This includes figures for the latest month and year-to-date consultations and the opportunity costs over these same periods. The Pharmacy First threshold is referenced by the dashed line. Pharmacies who met this threshold could successfully claim the £1,000 service fee as well as the individual consultation fees, and so they have no missed opportunity. If you notice that some local pharmacies are delivering far more claims, especially in Pharmacy First, it may point to training, operational, or workflow differences that are worth exploring. The final section includes data on flu prescriptions, broken down by both pharmacy and GP practice. This helps you understand who is capturing the most seasonal business and which practices are referring the highest volume of flu-related items. Use this page to get a complete picture of how your service delivery compares across key public health areas and to identify where you might strengthen your contribution, both clinically and financially. To wrap up, the final page of your report is the Action Plan template. This page is designed to help you turn insights into real improvements. You can use it to define a specific goal based on the data you've just seen, whether that's increasing service activity, improving item growth, or re-engaging with local surgeries. From there, you can map out the key actions, assign responsibilities, and set clear target dates. There's also space to track both financial and non-financial metrics across the coming months, so you can monitor progress over time. This structure allows you and your team to stay accountable and focused, turning insights into actions that drive meaningful results for your pharmacy.